When she was admitted to Westlake Community Hospital on November 8th, what was the admitting diagnosis?
Acute Xanax and alcohol ingestion, depression. She took an excessive amount, 6, of Xanax, and again another 6 was not suicidal. She is alert, oriented, and cognitively intact. She is not self-harmful, and there is no reason to keep her in the hospital. She is having breakthrough anxiety due to low tricyclic antidepressant level, impression, on axis 1 dysthymic disorder, on axis 1 panic disorder, axis 2 suspect personality disorder. I noted when I took the history that Mrs. Menendez was trivializing her circumstance, her overdose, or it appeared to me that she was. I noted that she seemed quite frightened. There was an interaction between her and her husband, which resulted in both of them wanting her to leave as soon as possible. They did sign out against medical advice. There was a sense, in my opinion, that she was not being honest. And when I find that a person is making me feel that they're not candid and forthright, I have a concern about character disorder or personality disorder. There is a note here on the emergency room form. Do not give patient her own medications. Attempts to put more pills in mouth when I was not looking. That is a nurse's note. I did recommend to her and her husband that she be transferred to a psychiatric unit for several days for purpose of stabilization. She requested that I follow the medications which had been prescribed by a previous professional, and I did so for approximately, I think, about 8 months, 9 months. I was giving her Xanax. It's a much higher dosage than the average person requires. Xanax is a so-called minor tranquilizer, which is an inhibitory medicine and diminishes the emergency fight-flight response. That is at the basis of anxiety. What struck me about this person was that she seemed inordinately more distressed than many people I usually see with these diagnoses. I could never understand her level of professed distress. I queried Mrs. Menendez on each occasion about why she seemed to be in persistent distress. And I never received an answer that made me able to explain her level of distress. It was my opinion that here was a woman who apparently had some kind of marital problem, which I thought that was the difficulty, but was unable to extricate herself from it and unable to shift and do what apparently needed to be done in order for her to improve her circumstance. That is the reason why I would still suspected a personality trait or personality disorder.
Did she appear to you to be secretive during the time that you consulted?
Yes, she gave me her explanations to the best of her ability, but I was not able to comprehend because they were couched in physical complaint terms without sufficient data relevant to her life. So I never felt that I really had the information necessary to really understand her. And if you want to use the word secretive, or the information just wasn't there. The woman never was able to articulate, other than there was some problem with her husband. I tried to get her to give me more data, but I never got it.